YouTube is back on. All right, now I might have made a mistake. I might have accidentally opened up the room I used for my high school Zoom instead of my room for IC. And that might be why Facebook couldn't get in. Oh, hold on. I'm not perfect. I make mistakes too. Okay.
Recording in progress.
Okay, I'm not recording. I'm turning it off right now.
Recording stopped.
There you go. Proof. I don't record the Zooms. Okay, the Zoom meeting is launching right now. All righty. Okay, Kayleen. Anybody on Facebook? Now try that link. That was my bad. I think I screwed that up. Okay, while we're waiting, and so let me grab this invitation here. Okay, and yeah, totally different. Yeah, I did. That's what happened. I set up a personal meeting instead of the IC network meeting. Oh, I'm sorry. Okay, so let me just copy this invite link and YouTube. It's a different password and everything. Oh my God, I'm an idiot. How did I do that? Okay, so over here. Got it. Okay, so YouTube, there is your new invitation. All right, Kayleen, can you try now? Lindsay says, can PR be taken daily? Yes, that's what it's meant to be taken. I take it every night. Okay, I wanted to go back here. Hold on a second. Lou said, I have confusion and hallucinations with UTIs. I thought someone was standing in my bedroom and almost shot them, then thought it might be a stroke, so he went to the hospital and they found UTIs. This comment, I have heard of that happening before, hon. I've definitely heard of that happening before. You know, UTI, especially if you're a little bit older, UTIs are pretty well known to cause confusion. Tony says, for a long flare, not responding to my usual measures, would you recommend cystoscopy with hydro versus installation? My usual uro wants to do a hydro for every flare. It claims he has put patients in a month for 3 months. Okay. So there's a fundamental challenge with his approach. And that is that the reason why you feel better after a hydrodistension is because it's breaking the nerves. So your bladder is a hollow organ, and the worst thing you can do to a hollow organ is stretch it. And when you stretch it, what is that? What is that spot? Oh, it's a little scab. Who knew? All right. I was looking at that spot right there. That when you stretch the bladder, you're pushing the tissue to its maximum limits. And what happens is you end up stretching and then breaking the nerves that control frequency, urgency. And the problem with that then is that, yes, you might be pain-free for 2 to 3 months, but the nerves always grow back. And sometimes more nerves grow back than you originally had. And that's a bad thing. So I call a hydrodistension a destructive therapy. It's a destructive therapy. You feel better because it hurts something, but it's not ever going to fix you. And so you're dealing with the symptoms rather than the cause, Tony. And it's important that you work on the cause. So we have to try to figure out is what is driving your flares. Is it because your bladder wall is being irritated by estrogen because of estrogen atrophy or from chemical exposure? Or is your flare a pelvic floor flare from having very tight muscles? And if that's the case, doing a hydrodistension, which is going to hurt like hell and make your muscles tighter, doesn't make any sense at all. So I don't know any top tier doctor, IC doctor in the country who would do a hydrodistension with every flare, because it's not addressing a fundamental problem. We got to deal with the anatomy, the dysfunctional anatomy first. All right, so hold on a sec. All right, I see you, Kayleen. There she is. She stepped up for a moment. All right, so Facebook, if anybody, I made a mistake with setting up the Zoom. It was my bad. That is the correct link to get into the Zoom chat. Hey, girl, how are you, Kayleen? Nice to see you.
Sorry, I just had to get a.
Oh, that's okay. So that was totally my bad. Thank you for pointing out that I clearly made a mistake.
If anybody,
Okay.
I made a mistake with setting up the Zoom.
Yeah,
That is
Facebook. There we go.
There you go. Well,
Okay,
how are you doing? You look great.
Well, thank you, but I'm not doing too good.
Oh no, what's going on?
Kind of hear it in my voice. I actually just went to get a Zofran because I'm like, I need to talk to Jill. And
Okay. Well, hit me. Hit me. Tell me what's going on.
So this all started out with gastritis from the steroids that I was taking for my back.
Yeah.
Oh God, I don't know. It's like meth and something, and it has prednisone in it, and I don't know. But
yeah,
the first day I was taking it, I'm like, why do I not feel good? And then the last day, I was like, I'm gonna puke everywhere. Like I feel so sick, and I'm like, I might have to go to the ER, and I'm like, well, let me go to bed and see how that is.
So when did you start taking it?
I finished on the 28th, so
okay,
the 22nd, I want to say.
Okay, so you took it for about 5 or 6 days.
Yeah, and then so I went ahead, went to the ER. They gave me some fluids, which didn't actually work. It was in like right here.
Okay.
Which it was actually going into my tissues.
Okay.
So I wasn't getting a lot of the drip. And then they did some chest x-rays because I was dry heaving and my heart rate was like sky high. I mean, 26 years old and in the 120s and 140s. So
yeah,
they were like, that's not normal. So and then blood pressure was really high. The blood pressure cuff was actually making me more nauseous. So every time it would start going up, I'd have to take the bag and be like,
yeah. So has it gotten better? Has it gotten better since you've stopped the meds? Are you making progress?
No, pretty much. He said it's going to take 3 weeks to 6 months in order for me to she's hungry, so
that's okay. I love cats. You keep her there. You keep her right there. I love kitties.
But well, she'll come back up. He said it's going to take 3 weeks to 6 months. So
did your gastritis change at all?
No, I think it actually is what pushed on this UTI that I have now, which is actually kidney infection, which I'll get into. But
holy crap!
So I had to go back, I think, on the 4th or the 5th.
Okay.
Now because I didn't feel good. We celebrated
Yeah.
4th of July and everything. And that's one of my favorite holidays, even if I don't get gifts. It's just, I'm so patriotic.
Yeah.
And I love the country music that we get to watch the fireworks and
Yeah.
in a small town football field that's about 15 minutes away from here. So we parked about a block away, and I could, like, my mom's like, you know, you're gonna hurt, you're gonna be in pain. And I'm like, I don't care.
You want the fireworks. Give me the fireworks, baby.
Yes. Tried to get as much Gatorade as I could in me. Water is making me so nauseous. I have to drink Gatorade after taking Zofran because of the chemical taste. But like Gatorade is mostly what gets rid of the nausea. But so like I'm not drinking water, so and I'm not eating. I've already lost about 8 pounds.
Okay.
It's just, I mean, sometimes I'll lose 4 pounds in one day, and
yeah.
Oh my God, it's just too much. But
so are you working with a gastroenterologist?
Yes, I see her because my current one is out until September. But I see the nurse practitioner, and I have to tell her about something else, which is definitely what I'll tell you about at the end of the story.
Okay. Are you belching a lot? Are you getting a lot of gas in your stomach that hurts?
I mean, it does kind of feel like ulcers. So I don't know if I might need an endoscopy.
But well, sure. I mean, endoscopy is a piece of cake. You might as well let them look at your stomach. I mean, seriously, your life has been upended by stomach symptoms.
That day that I did go into the hospital, into the ER, and they gave me fluids and everything. A half an hour before they pulled me back, it felt like I was breathing on top of a sword.
Say that again. It felt like what?
I was breathing on top of a sword. Like my stomach is a sword.
Okay.
And I'm just, every time it expands, it feels like that big poking feeling, and stabbing. And,
where is it? Where are you feeling that? Are you feeling that right along your sternum here? Are you feeling that under a breast or under your rib cage, or?
It's here, and then sternum, and then the top of my stomach is, I think, what has the gastritis. So like the bottom of my esophagus, and then the top of my stomach.
Mm-hmm.
It's just it's what hurts all the time. It doesn't matter if I'm laying down, sitting down.
So are you belching? Do you have gas in your stomach and you feel like you're belching?
Yes.
Okay.
I for some reason I burp a lot when I have a UTI or a kidney infection.
That's weird.
So
for people who are watching or listening, because Facebook and YouTube are still on, so they can hear us. We certainly know that obviously there's a very diverse population of patients, and one of the populations that we have are people who have chronic overlapping pain conditions, which Kayleen has and which I have. And none of the studies really explored stomach issues in depth. And so we ended up doing a survey, I don't know, about 7-8 years ago, of a huge group of IC patients. And we asked them, do you have any stomach issues? And if you do, what are they? And I was shocked. I was shocked by the number of patients who reported stomach issues. Like it was 90%, it was like more than 90% of IC patients have at one point in time had a bout of gastritis, GERD. There was a lot of GERD, a lot of gastritis, and a lot of gastroparesis. And so I know that I went through a couple of summers where I got hit by gastritis really bad. And I'm telling you right now, Gaviscon is fabulous. Have you tried Gaviscon yet? Let me go get a bottle and show it to you. So there's more to this. So let me.
Hi, Kayleen.
Hi. Nice to finally be able to see you since.
I know. I see you too, sweetheart. You're beautiful. How are you? Are you doing okay? Did you hear my story? Did you hear what I was going to do?
Yeah.
I'm going to try, sweetie. I'm going to try.
Yes, we are fighters. We are.
You know what I'm saying? We have to be fighters, you know? Jill sets us
Absolutely.
up to be fighters too. Go ahead,
Amen.
baby.
We are. All right. So Gaviscon.
Ooh.
Gaviscon, what Gaviscon does, according to my gastroenterologist, so it's very foamy. That's a good taste. It's not like Mylanta, it's not strongly
Yeah.
icky like that. What it does is it creates a foam over the top of whatever's in your stomach to prevent it from getting up there and irritating your esophagus. And so Gaviscon is a must in my family. So as you can see, I don't even have the lid on it. I go through Gaviscon, not daily, but every now and then I do. So anyway, in this survey of patients, gastritis was number one, or diagnoses of gastritis. And again, I had 3 specific diagnoses of gastritis. And then eventually I got to the point where I was just belching. I had so much gas on my stomach, and ended up going to a new gastroenterologist who diagnosed me with gastroparesis. Have you ever heard?
It's bad.
Well, no, because it's mild. It's very, very mild. So you can have mild and you can have severe. Gastroparesis means delayed stomach emptying. It just means that food sits in your stomach longer than normal. And because that food is sitting in your stomach, it starts to ferment. And as it's fermenting, what does it do? It produces gas and you belch. Okay.
I've been
And
tested for it, but
have you been tested for it?
yeah. It was actually pretty fun, even though I couldn't stop pooping. So I'm like, I definitely know that I don't have, I don't have it because you just fed me and I can't stop pooping. So, but so I went back into the ER and it was the same doctor, and it got hot in the room when when I had him.
That's always so hard. Yeah, when you're feeling like crap, and George Clooney walks in the room, very cruel.
It was the same doctor, but I went in there for psych and pain. I was just like, I can't take it anymore. I don't know if I'm having suicidal thoughts, but I'm like, I don't know what to do. Like, it's the solution has to be solved, or like just take me out of my misery. And I don't want to have suicidal thoughts. I've had them before. They're not fun at all.
Yeah.
But they pulled me back right away, and they gave me a GI cocktail. They did a whole bunch of tests, and of course, I did a urinalysis. Well, he told me that everything looks good, so I don't need to medically be admitted.
Okay.
That I should be, psychiatric admitted.
Sure, of course.
He told me, he's like, I can send you off to the hospital of choice that you want to go to. He's like, other than that, you can go home. He's like, I just want to make sure that you're going to be safe. And I'm like, as much as my mental health is important, I'm like, my birth control also is, because I had the ring, and it's for my endometriosis. And I did not know this, but when she took it out, because I couldn't get it. Like, I think it's just because of how messed up my back is.
Right.
Right. And how I'm so tight.
Yes.
And like, the vulvodynia and everything. Once she took it out, I was walking out, and I was like, Mom, like, I can actually walk. Like, there's no pressure on me or anything. And I didn't realize it because I didn't want to stop the ring. Well, I'm on the patch now. But yeah, I had her, the OBGYN appointment with her the next day. So I was like, I really have to go. I love her. I trust her. She's always concerned about, my health and my mental health.
Yeah.
So I went ahead with her. And then I waited, I think. Yeah, I saw my, I saw the urinalysis and it looked really ugly, even though he said it looked fine. But the culture didn't come back until Sunday, and the culture showed up E. coli. So I'm like, oh my God, I have another
Girl.
UTI. And obviously, so I called the after hours, and excuse my French, but she was just being a bitch. I mean, she's like, I'm not reaching your urologist because he's not open right now, and he won't answer if he's at home. He doesn't have access to your chart. So I couldn't get my I couldn't get my antibiotics.
But do you have them? When was that? When was that?
Oh, I think it was last Sunday that I found out that I had the.
And are you still taking the antibiotics now?
Yeah, I didn't start until Wednesday because he didn't get the information about my urinalysis until Tuesday. Tuesday morning.
Yeah.
And I was like, I can't pick him up right now. I have no way. And so my mom came home that day, and I'm like, Mom, I'm in a lot of pain. It's my back, it's my stomach, it's my bladder. And we went ahead and went back to the ER, and I picked up my antibiotics before that, and they didn't do anything for me, but I was peeing blood. Yeah. I mean, it's straight blood. And obviously I don't have my period because I'm continuous on the patch, and I was continuous with the ring. Like, I didn't take it out for the, the 3 weeks.
Right.
So yeah, thank the Lord for my OBGYN. She agrees that I don't need to have a period if they're really painful for me with my endometriosis. So, I didn't start till Wednesday. The ER doctor didn't do anything with the blood in the urine. He's like, well, why am I doing anything if you're having antibiotics? And he put in the notes that I said that I'm refusing to take the antibiotics, which that is not true.
Right.
I asked them if I can take the antibiotics, and they're like, oh no, you can't drink water, or you can't take meds while under our care. And I'm like, but it has now gotten worse. I went to my urologist on Friday, and they saw how miserable I was. Like the nurses and everything. Still, the receptionist was very rude, but they just saw how miserable I was, and they're like, well, you're supposed to be having your bladder installation today, but with how miserable you are, like we can't do it. And plus you have now a kidney infection. Because since I had to wait so long, it's a kidney infection now, especially with me bleeding. And he told me to sit on the edge of the chair, and I'm like, I can't do that. I'm like, it feels like there's a rod going up into my back, like up my butt or something. So I stood up, and he examined me, just pressing on my stomach and my back. And I was like, this hurts so bad. And even like, he stopped pushing it. So like when I was walking out of the procedure room, I was still having the pain. And
hon, I mean, this is one of those situations where, number one, first of all, none of this is your fault.
Right.
There is no shame. There is no blame. And for those of people who are listening, Kayleen has been a longtime member. She had a very serious back problem. And her back, she was supposed to have back surgery in June, and it got all messed up. And, for months and months waiting for back surgery, and then it didn't happen. And she's really compromised by, and you've talked about that, hon, that as long as your back is messed up, other things are going to be messed up too. And I think, I think that it's gonna it. You see, you remind me of me in my 20s. Where you're just kind of like spinning in a circle. And it's like, what the hell is going to happen next? First in my stomach, then it was migraines, then it was ovarian cysts, then it was this, and then it was that. And it's so unpredictable that you're just baffled. All you know is you don't understand why you're not getting answers, the answers that you'd like to have, and you're struggling, and so you have to break you cannot allow all of this to weigh on you at one time. We have to break it into manageable pieces, right? So your back is a separate and distinct issue, and how that's going to be addressed is probably a whole nother conversation.
It's sucking the life out of me, though, man. It is. I mean, I can't do anything. That's why my cats are hungry right now, because I can't constantly bend down to feed 2 cats.
Right.
Scoop and then.
Well, yeah. You're gonna. This is when your cats get permission to jump up on your table. It's like, come on, hon. Come on.
That's how I can pick them up and terrorize them.
That's okay. There you go. So there's good news in this situation. And then number one, we clearly know you have a UTI and you have a kidney infection. So that's established. That's provable. Nobody can tell you that it's in your head. It's being treated, right?
And they diagnosed me, both ER doctors, no, 3 ER doctors, since I've been in the ER so much.
Yeah.
With last month, they all diagnosed me with interstitial cystitis, but still, it needs to be my urologist that says it, and so I still don't have the diagnosis technically.
Okay. Well, I think but it's more than interstitial cystitis. You have a low back issue, and you've got endometriosis, and you have vulvodynia.
Yes.
And you've got your gut issue. You're like where I was in my 20s. I mean, you really are. And I just think that number one, you have to follow every pathway to its end. I mean, if you have to keep pushing for the UTI care, just like you have to keep pushing for your back care, just like you have to be pushing for this or that. And I think one of the challenges that you face, that we all face, is that we're so freaking young at the time that they just didn't take us as seriously as they needed to take us seriously, and we did not know how to advocate for ourselves. And so, like, if I were in your shoes, I would be, all right, number one, we have a proven kidney infection. What are we going to do for that? Number two, it's very clear that I have stomach gut issues. Can we try to establish that diagnosis a little bit more? So you've had the gastroparesis test. That's negative. Power to you. That's awesome. Okay, but clearly something is irritating the hell out of your stomach and potentially out of your bowel. And hon, this, again, if you've never tried Gaviscon, it would be a very interesting experiment. It's right next to the Mylanta. It comes in cream. It comes in the liquid. I think the tablets are much better than the liquid because I have gastroparesis. I have delayed stomach emptying. And so if I cross that border, there's always a line that I can't cross. And if I do cross it, I will end up with some stomach stuff. And this is my go-to. So separate and distinct. Don't lump it all together. Separate and distinct. But you also still have to we have to keep you optimistic and confident. We have to build your self-esteem up, which is what I had. My self-esteem was nothing back then. And it wasn't until the research that came along that talked about families and genetics and stuff that, my dad has the same stomach issue that I have. My dad has the same heart thing that I have. There's so much inheritance going on, and that just takes so much the guilt away. you know, a feeling like I'm being punished and that there's something fundamentally flawed. No, it's just we have to find what works for us. And clearly something isn't quite working for you yet. Have you tried an elimination diet for your stomach?
Yes, that was 2 years ago. I still do dairy because me and my gastroenterologist did find out, well, old gastroenterologist, she had left, and that's how I got a new one. But we both found out that, I mean, I have no family history of lactose intolerance, but milk just doesn't bother me. And I'm low on vitamin D, so I drink whole milk.
Okay.
Don't
but-
take.
You aren't taking a vitamin D supplement?
Not anymore. I ran out of what you gave me.
Okay. Okay.
But I have a vitamin D test coming up anyways, so I
Okay.
have to test.
That's good. That's good.
But the good news is something is happening with this kidney infection.
Okay.
My urologist, he's like, I really want to see, see what's inside of you after you finish your antibiotics. So I have to finish my antibiotics first, and I need to get a CT scan, and that's going to tell him if we need to go in for cystoscopy, and I can't really say it. I could say uterus, the tubes that go to your bladder.
Right.
I used to be able to say that. I thought I could just
A
say that, but-
ureteroscopy, something like that. Yeah.
Yeah, he did that. So, I mean, this is going to determine if I have stones because it's either Hunter's lesions or, lesions in my tubes,
All right.
or that, I do have kidney stones that are passing, but they're scratching, on the way down.
Okay.
Which, oh my God, I am just, I'm in
Well,
so much like.
Okay, but girl, listen. And you guys, I'm going to say this in the best possible way. I want you to embrace it. I am a tough bitch.
Yes.
Because
That's me.
you are. We all are. You know,
Yes.
think about what you've gone through, and you have a smile on your face right now, and honestly, you're glowing. You look great. You both look great. Whereas I look
You look beautiful.
terrible right now.
Beautiful. 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 You are.
You know, but I mean, I just think, listen, I don't have the answers for you at all. This is about you following every pathway, trying to find answers in every single pathway, because your case is obviously very different than mine. I do think your whole lower back issue could be driving all of it, and I think we've talked about that before. But that said, now listen. What are you doing every day to keep your head in a good place? Are you doing some relaxation? Are you
pretty much? I mean, it's like, well, because I've already been in the psychiatric hospital. I was there back in May.
Yeah.
Which I don't know if I told you about.
Yeah, you did. You did. We've talked about that before in the group.
Oh yeah, I did, because I told them about the tapping, and
Right.
they like this better, and I'm like, no, I like the tapping.
Yeah, I mean, so are you doing that every day? Are you doing your tapping? Are you doing your I Spy? Are you doing those?
No, but I am doing. I mean, I love showers, so.
Okay, but not good. That's not enough. That's not enough, right?
I mean, I do relax in the shower, like.
Okay, no. Okay, so remember, so it's completely normal to have anxiety when you have chronic overlapping pain conditions. You have anxiety. I had anxiety. This is common. This is your brain. Your brain is in fight or flight. You're in pain. You've got a back injury. I've got a back injury. When you're in pain, your brain's going, what the hell? Oh my God, my life is at stake. You go into fight or flight, right? So,
I
so
just started today peeing like frequently. Like, I mean, with this gastritis, you know, it's so hard to get things into me.
okay.
So
Okay, but listen, we have physical, mental, emotional. Okay, you have to ground yourself every day. You just like if you're angry, you're gonna pick from 10 to 10:30 in the morning. You need to be angry. Great, you be angry from 10 to 10:30 in the morning. You write in your journal. You scream in the shower. Whatever you need to do, you get that out. But then from 10:30 to 11 in the morning, we've got to just calm your central nervous system. You got to do I Spy. You got to do tapping every single day. I did it. I got to tell you, my brother annoys the hell out of me. Like, seriously. For God's sake, dude, it's summer. Come visit your parents and help. Oh, no. No. What is it about? What is about?
weird.
I know. It's like I sent him an email, said, could you please call and help? It's like, no, they can call me. It's like, dude, they're your freaking parents. You know, so anyway, let's just say I got myself really worked up a couple of days this week, and I could feel myself getting worked up. And I went out and I sat on my front doorstep and I did I Spy. It's just like I could feel everything getting out of control. And which is what, you know, that's what happens. And you and I, we all have to take responsibility, not only for our physical health, but for our brain health and our emotional health. And I know you love showers because I love showers, but that's not going to calm your central nervous system down. We got to calm your central nervous system down. There was on TikTok yesterday. God, I should find it. There was somebody, an anxiety specialist who was talking about fight or flight, runaway fight or flight, and how do you get your brain out of fight or flight? And what she said is fill up a bowl with cold water and put your head in it just for a couple seconds and pull it out. And that literally forces the cold, forces your brain to process the temperature change, which literally breaks us out of that fight or flight. So what I wish for you, hon, I wish if I could go back in time and talk to myself, I would say, number one, it's okay if you don't feel well that day. Don't feel bad about it. Number two, ask action satisfaction. Just be the squeaky wheel. And because you pay them, they don't pay you.
That's right.
Okay. Right. And so keep asking, keep pushing, but you have to do it in a respectful way. And try not to lump it all in one big giant piece of the puzzle, because you can't do that. There are too many issues going on. But fundamentally, we've got a serious low back spinal issue combined with a lot of nerve sensitization that's causing the vulvodynia and some of the bladder stuff like that. Those are in all likelihood some of the driving forces there. And don't let, you know, God, how do I want to say this? Don't let anybody talk down to you.
It's been the doctors, but I go home and I'm like, they said this, and it's just like, I don't believe it. And it's like, they don't know my body, but
I'm not sure I understand.
I don't let them. I mean, I'm here. I was just trying to get an OBGYN for my endometriosis, because the one that I said that I love, you know, she does my birth control and everything.
Yeah.
She doesn't do endometriosis. She's mostly obstetrics.
Right.
So I have to get, you know, obviously an OBGYN for my endometriosis. She's already sent her referrals. I mean, I can't go to Chicago. Like, I can't afford that. And neither can my family. And I'm not being a new driver.
Yeah.
You know, driving to Chicago on my own. No.
Yeah,
Um,
that would be hard. But you know, hon, just I need you to have good habits every day. I need you to have good habits with your muscles, with good habit with whatever you can do with your muscles, good habits with whatever you can do for your soul and your spirit, whether it is listening to somebody or reading somebody that will give you some comfort, having good habits with trying to keep your brain calm and collected, and you know, I think that you have every right to be angry for the way you've been treated. I think we've all been that, but you've really been through that. And I think it's very important that you not let the anger consume you. Like literally from 10 to 10:30 in the morning, that's your angry time, and then be done with it. Right? If you need to write in your journal, do 10 to 10:30, do it and be done with it. And use your affirmations. I can do all things. Be bold and mighty forces shall come to thy aid. Do whatever you can say to yourself that will give you some of that comfort. And, you know, hold on a sec.
I don't know if you guys can hear it, but
what, baby? What you saying?
I kind of lift it up or lift up my back up.
Yeah.
Yeah.
I don't know if you can hear it.
No, can't hear anything.
My massager, I have it connected to the USB, and I have it on high right now. So
That's got to feel good. That's got to feel good. Well, listen, hon, listen. You know, we love you, and we know that we care for you, and we support you in anything we can do. You are as deserving of anybody else, and I'm so sorry that you're going through the struggles that you're going through. I've been there. We've all been there. I think you're a tough bitch in the best possible way, and I want you to, you know, like I have this T-shirt from Hillary Clinton's campaign that says "nasty woman."
Yes.
And I got to tell you, when I'm feeling like I need to be really firm, I will either put my ninja shirt on. You saw me wear my ninja shirt on, or I wear my nasty woman shirt, because I just need to remind myself that I have to be strong and tough and assertive, and I'm not going to let. I'm not, you know, I'm not here because I want to be here. I'm here because I'm in pain and I want some help with this. And I'm not asking for pain meds. I want you to help me understand why I'm in pain, what's causing this pain, and all that sort of stuff. So you just keep on keeping on. And if you need a pep talk, you know who to call. And Kayleen, I think you're strong. You're far stronger than you realize you are. But now we need some good routines. We need a good routine. And I want you to find something that brings you joy. I mean, obviously your cats bring you joy.
Sometimes.
Sometimes, yeah.
They do. Our couch, our chairs in the dining room. Oh my God.
Yeah. It's
he is everything.
Just laugh when you can laugh, smile when you can smile, cry when you need to cry, but got to open up those drapes, and let's just, every day is a new day, a new opportunity. And let's not assume the worst. Let's assume the best. For all we know, the next doctor you see will be able to, you know, solve or help us understand more one of the pieces of your pain.
Well, I'm from Illinois, and they've been talking about UW, and I'm like, I can't go to UW because that's out of state, you know, University of Wisconsin.
Yeah.
But that's where I would have the neurosurgeon and the OBGYN. And what they're going to have to do is they're going to have to work together, because,
good.
I mean, DDD has gone down to my S1. So,
yeah,
you know, that's pelvic. And I even feel like I'm walking sometimes, and it's like my spine is being pulled up, and my vagina is along with it. So it hurts.
Yeah. Well, all right. Listen, just keep calling, keep making those appointments. Go to those appointments. Tell them that you're there because you're humbly asking for their support. Tell them they need to work with each other, and carry hope in your heart. Okay, don't alienate them, but get them on your team.
It's backwards, but I painted this in
nice
at the hospital. It's the champion logo.
I love it.
Yes.
Be tough. All right, ladies. Well, listen, we've been going a little long here, so I need to shut down Zoom. Big giant hug.
All right. Thank you.
Right?
You
Big
too.
giant hug. Okay. All right. I'm going to shut down Zoom and we're going to come back to Facebook and YouTube. All right. See you later, you guys.
See you, baby.
All righty. Let's see. I want to end Zoom and not YouTube like I did accidentally last time. There we go. All right. YouTube, Facebook. There's my Facebook. So you guys, I mean, the take-home message that I want you to really remember about Kayleen's story is that there's layers. There's layer upon layer upon layer. And what does Dr. Weiss say in his book, Breaking Through Chronic Pelvic Pain? He says, Western medicine fails the pelvic pain patient because doctors like to stay in their sandbox. Urologists stay in the urinary tract, gynecologists stay in the reproductive tract, gastroenterologists stay in the bowel, and they don't necessarily understand relationships. And here's the hard reality. The hard reality of your pelvis, it is crammed full of crap. No, not literally. I mean, look, so I want you to see what happens when we start putting all these organs in here. And when you see this, you will see that there's no way that they cannot influence each other. They absolutely influence each other. And that's, I think, what Kayleen is struggling with right now. And I think she agrees with me because her fundamental problem really is a very serious back issue that's causing a ripple effect through her pelvis, right? Okay, so here we have the pelvic cavity. So the first thing we're going to do is we're going to put the uterus and the ovaries and the vagina in. Then we're going to put the bladder in, right? So look, you can see that if you've got pain right above your pubic bone, bam, there it is. That's your bladder. And then we're going to put the bowel in. And the bowel kind of curves around, right? So look, so now we've got, actually, that's the wrong side. No, that's the right side, right? And then, of course, you've got blood vessels, you've got muscles, you've got nerves all in here. And it's really kind of a ripple effect. I mean, I can remember in my 20s, it's like, what the hell's going to happen next? Vulvodynia, so frequency urgency in 7th grade, vulvodynia in high school, ovarian cysts in college, IBS in my 20s, et cetera, et cetera. And it just was baffling. But now we understand the connection. The challenge is we keep chasing organs. And that's where the mistake happens, because it's about how they influence each other. So if you have tight dysfunctional muscles that are restricting blood flow, yeah, you're probably going to have some bladder issues and some vulvar issues. Just like if you've got chemotherapy-induced cystitis in your bladder, screaming in pain, your muscles are going to get tight. If you've got endometriosis, now imagine now somebody's got endometriosis. So that's now passing through the pelvic cavity, attaching to wherever it can attach, might even be going up higher than that, wrapping around nerves, wrapping around, interfering with muscle contraction and muscle function, et cetera, et cetera. It's a really challenging area. And so as you're trying to seek treatment, you still have to look at relationships and the ripple effect of tight muscles, the ripple effect of a ruptured disc in your back, the ripple effect of endometriosis. And it's easy to chase symptoms like the person who was having hydrodistensions every time they had a flare, which doesn't make any sense at all. We have to instead try to get to the fundamental underlying causes and try to deal with that if we can. So obviously in her case, and she's shared her story, she's come in several times in the last 6 months and has helped us understand the many obstacles that she's faced. And that's true for so many of us. I mean, it's, I think, again, if I could go back in time and talk to myself back then, I would just give myself a hug and say, honey, it's not your fault. It's not your fault. And let's just, we just got to keep removing layers. And for that doctor who said to me when I was 33, you will forever live in pain, get used to it, this is your life. Well, F you, dude. You're wrong, because I don't have pain every day anymore. I haven't had bladder pain in a long time. And if I do have pain, it's pelvic floor pain, and or, occasionally I tweak my stomach a little bit. And it's about finding that environment in which our body thrives. We have to figure out where we work and function the best. Like for me, I live in the country. I'm not happy in crowds. I'm not happy in the city. I'm not happy in the car. I'm better off being out in the country where I can do my thing and it's not triggering my nerves quite so much. So anyway, Kayleen, if you're listening, and I know you probably are, you're a beast, my friend, in the best possible way. Tony says, I went for a second opinion. New Uro said I should not do a hydro. In his opinion, I have pelvic floor. Yet the last cysto showed glomerations, which, so Tony, we've thrown out glomerations as having anything, they're not meaningful. Having glomerations on your bladder wall is caused by the test. And so they have thrown out glomerations as having any significant role in making a diagnosis of IC. When you stretch the bladder, you damage the bladder wall, it causes glomerations. So that's not meaningful. And Dr. Phil Hanno chairs the AUAIC panel, and who is a professor at Stanford University. I mean, he just flat out said a year ago, he said, glomerations are not meaningful at this point in time for a diagnosis of IC. If you've got tight pelvic floor muscles, follow that pathway. Bethany says, I was diagnosed with IC many years ago and was in remission for over 10 years. Symptoms started again in March. So you went to Uro during a cystoscope a few months ago. My Uro found some small polyps in my bladder, but he does not believe in removing them. What are your thoughts on this? I'm starting to feel a bit better, but still have some sensitivities. If I consume them, it feels like acid burns the bladder. So Bethany, in many cases, the reason why symptoms return is because you've gotten older and you're now showing changes in your skin related to estrogen atrophy. And so, some patients are really surprised by that. It's like, I was doing so well for 20 years and all of a sudden, bam, they came back. I'm 54 now, or 52 now, or 61 or 71. And at some point in time, the urinary tract reacts to the lost estrogen, and you start getting a thinner bladder wall, which then, this is a perfect picture of what that looks like. The lost estrogen, bam, you just don't have that nice thick coating. And now things that you might have enjoyed in your 30s and 40s and 50s, like a cup of green tea a day or a multivitamin a day, are triggering you now because you can't protect yourself. Your bladder wall can't protect itself. That's not a disease, hon. That's not a disease. That's estrogen atrophy. That's aging. So I would be the very first thing I would want to know if I were in your shoes. So I would ask the doctor, what's the health of my skin? Am I showing signs of estrogen atrophy? If I am, that's probably why your bladder is reacting. Now, the polyps, polyps are, I really have rarely ever seen a discussion of polyps in any IC literature. I have seen a discussion of polyps or bumps on the trigone. And the trigone is the triangular area between the two holes for the ureter all the way down to your urethra. And the trigone has different cells in it. It uses estrogen. I think it's more estrogen sensitive than other cells. I don't remember off the top of my head. But I do know that the trigone can be bumpy. For some patients, it's bumpy. And they used to call it trigonitis. And I remember when I started the IC network and I was doing all my due diligence. And so I was getting information I could on every disease that affected the bladder that could be involved. And I remember in that discussion that some doctors felt that a bumpy trigone was not healthy, and so they lasered the trigone off. While others said, come on, that's just normal. There's no reason to do anything with it. So, I guess the question I would be asking your urologist is, are they going to biopsy it? Let's just get to the heart of the concern here. If there's anything to worry about, it's like, you know what, just snip one. Let's just take it, just send it in for a biopsy, see if they can identify it. But polyps are unusual. And if it were me, I think I would say, all right, I'd love for you to biopsy it so I don't worry about it. I had polyps in my uterus. So, I ended up having a hysterectomy because they were the wrong kind of polyps. They were the wrong kind of cells. So Tony says Gaviscon is a great product, creates the raft because it contains sodium alginate. But regular USA Gaviscon does not. Yeah, it contains aluminum hydroxide and magnesium carbonate. I think alginate is an aluminum variant. Don't remember. Or I think. It's a guess. Maria says, just had my second Pfizer COVID shot. My bladder flared. Will this pass? What can I do to help this flare? So it should pass. I mean, I think with the informal data that we've been collecting on the vaccine, 85, 90% of patients who got their vaccines had no problems, but about 10% flared. They seem to be pretty short-term flares. I would follow the diet. I would make sure you're diluting your urine just to try to create a really good environment that will support your bladder for healing. And then maybe dive into something like Bladder Builder or Peora, or maybe ask your doctor if you could do a rescue installation. Maybe some heparin and lidocaine in there that will numb your bladder wall would be reasonable. But you're absolutely not alone, hon. Absolutely not alone. I can tell you that I've been talking with Dr. Theoharides, as well as a couple of other doctors, about more COVID and IC research. Christy says, has anybody received Social Security disability for IC? I had a biopsy of my bladder and it came back that I have IC, and I was denied any ideas on what other proof Social Security would need. So yeah, Christy, absolutely. Many IC patients have gotten Social Security disability for their IC. But Social Security has a ruling on IC, but it is not on the list of automatic approvals. So you really have to build your case. Understand that Social Security does an automatic denial of applications, like literally 85, 90% of applications, maybe even more, are denied first try. And that's as somebody, I worked at Social Security for a year before I went to grad school. I was a black lung specialist years and years and years ago. It's a terrible place to work, to be quite honest. I having been there and worked in that situation and worked with the disability analysts who made their decisions, I really almost think the denials are meant to test your mettle, because a lot of people, when they get denied, they just walk away. They don't understand that it's kind of it's a bit rigorous to get you to prove to them that this is important, that you're not faking it. And so, and then the other issue with Social Security is that when you're doing your application and you're making your case, you can't just rely on a diagnosis of IC. You've also got to discuss any other conditions that you've got, right? So whether it's TMJ, stomach issue, pelvic floor dysfunction, whatever. It's about building a case to support that your symptoms are so disabling that you are not expected to be able to work. Remember, state disability, which you normally get for a year, is designed to get you back to work. The underlying principle of state disability insurance is that this is transitional to try to help you get through whatever crisis you're going through and get you back to work. So you go on state disability if you break your leg, something like that, or you're having a baby, or you've got, I don't know, something that's fairly short term, 3 to 6 months, right? Federal disability through Social Security is designed for patients who are not expected to be able to work again. So you've got to decide, I think, number one, personally, do you want to work or do you feel like you can't work? When I got to that point, after my year of state disability, I wanted to work. So I was just determined to find a way to work, even though my bladder was hurting. So I worked from home and did some stuff like that. So that's concept number one, is you've got to really understand the consequences of this. It's really about you not being able to work. The second thing we've got to consider is, do you have a doctor that in your application is saying, yes, her symptoms are very severe. She has to urinate every 15 minutes, every 20 minutes. Her ability to do most jobs is going to be significantly impaired by her need to urinate. And then also you have to talk about sleeplessness, the consequences of having nocturia. Urinary frequency at night means that you never get a full night's sleep. So if you were driving a forklift, if you were doing something where safety is paramount, we really don't want you doing that job if you're routinely sleep deprived. And so talking about what the risks of sleep deprivation on your career is important. And then, of course, again, the other related conditions. The third thing that is really important for that, making your case with Social Security, is you really have to have objective evidence rather than subjective evidence. Subjective evidence is evidence it's like you saying, I'm in pain. And they're like going, well, what does that mean? Well, I'm in pain. No, what does that mean? How severe is your pain? On a scale of 1 to 10, how severe is your pain? Oh, it's a 7. But that's still subjective. There's no hard data behind that. It's just like you saying you're in pain. And some people will believe you and some people will not believe you. And so you having a pain diary or avoiding diary that you can periodically give to your doctor and put it in your medical records is important, because it takes the subjective into the somewhat not quite objective, but it's getting there. You're establishing a pattern of long-term pain and a pattern of urinary frequency. The reason why this is important, there is one IC patient who's an absolute hero in the IC world. She was a hero for 2 reasons. She was a hero in her workplace when she was really badly abused by her bosses because of her IC, and actually asked to demonstrate how to self-catheterize in a room of men. That was something else. So she sued them for disability discrimination. But she also got denied for Social Security. But she was a tough bitch. And so she appealed. And so the first judge denied her appeal and said, this is crazy, said, well, the doctor never said he witnessed her need to urinate. And of course, she and her attorney are like, how? Your doctor isn't there in the middle of the night when you're up every 15 minutes. For God's sake, that's ridiculous. Well, anyway, the first judge denied her appeal. Then she went again to the second level, and she got denied again for the same reason, that the doctor never witnessed her frequency urgency. Took her 2 years. She got all the way to the highest court in the land for Social Security, federal court. And she made her case. And they agreed with her. And she won. Not only did she won big. I mean, she got years worth of benefits. And the ruling, the judge said it is impossible for any doctor to witness your frequency urgency. And so she established an incredible precedent for the IC patient community who are trying to get Social Security. That said, if she had just submitted a voiding diary to her doctor, and preferably over a couple of years, they would have had all the evidence they need to defeat that argument. It's like, well, here's the voiding diary. Here's the voiding diary from 2 years ago. I was getting up 10 times a night. Here's the voiding diary from a year ago. I was getting up 12 times a night. Here's the voiding diary from 6 months ago. Look, I was getting up 15 times a night. And here, Judge, is the voiding diary I just did for you for the last 3 days. Here is my voiding diary. Here is my pain. And so you tracking your information and getting that into your medical records is really important. And that's one reason why we have put so much money into this new app called the Bladder Tracker, because it will allow you to track very easily your frequency and your pain. And then you can export the data. That's where we're running into some challenges within this right now. We want to be able to export the data in a really useful way. So we're working through a few bugs with that. But anyway, know that this is on the horizon, and my entire purpose with this is to allow you to track your symptoms, to give you the objective evidence that you need for Social Security disability, but more importantly, just so that you can see how you're doing. Is this therapy working? You started a therapy 3 months ago. Let's track it and see if we notice any trends. Are you getting better? Are you getting worse? And I just got an email while we were there from the developer. Hold on a sec, because we're really trying to power through stuff right now. Oh, Joanna, thank you for 145 stars. And you've given me stars 2 weeks in a row. Thank you so much, hon. Really, really appreciate that. All right. So the report is coming into a PDF file. All right. All right. So anyway, that's what we're working on. So I hope that helps. We have a disability resource center over on our website. We have links to the disability ruling for IC. We have tips on what to do and how to prepare yourself. Another thing to remember, when you're making an application, you have an option. You can fill out the application at home, or you can fill out the application at the Social Security office. Right? Okay. No. So number one, fill it out at home. For God's sake, fill it out at home, because they're going to ask you for a lot of detailed information, like, what are you doing on any given day? What's your daily routine like? What type of work do you do? All that sort of stuff. And then the next step is to have an interview with a Social Security disability claims rep, and they're really the first line of judgment. And you can do that by phone. You could do that by Zoom, probably, and you could do that in person. But when you go in person, for God's sake, don't dress up and put your makeup on. And for God's sake, get up and pee when you need to get up and pee. They need to see the real you. They need to see what you look like in the middle of the night. And I think that that's one mistake that people have made when they've gone for disability. Is you're going in, you're trying to make the best possible impression. And the thing is you're making too good of an impression. You got to be real. And most importantly, when you're doing that interview, you need to say, where's the bathroom? And make sure you get up and use the bathroom. You know, if you have an hour-long interview, then you should be getting up 2 or 3 times in that so that they can really see what you're dealing with, okay? I could say more. Zelda says, every time I watch you, I learn so much. Thank you. Oh, thank you, Zelda. Thank you for your patience. Sierra says, pelvic floor will help that. Pelvic floor will help. Oh, so Sierra also got the COVID vaccination, and she too also had a flare with her vaccination. And yeah, pelvic floor, you know, I mean, we got to be real here. It's intimidating having your COVID vaccination. There's a lot of bad information out there that's scary. I think that none of us went into the COVID vaccination feeling uber confident. I certainly didn't, you know, because there's so much misinformation about that. And so that's stressful. It's stressful to go there. It's stressful. You worry. And when you worry, what happens? You know, you engage fight or flight. Your heart rate gets up, your blood pressure gets up, your pelvic floor muscles get tight, and bam, pelvic floor flare. Right? It makes sense. All right, Rhonda says, I've been really having a problem with pelvic ongoing pain, with pain after a bowel movement that lasts more than 2 hours. I'm so confused. Everything I'm trying to do to relieve the pain seems to make it worse. If I take a laxative, it hurts my pelvis and my rectum. I stay in pain for a long time, thinking after I move my bowels, I would feel better, but I don't. It hurts. You had a transvaginal ultrasound. And the gynecologist said everything looks good. I said, no, something's wrong. She called the GI doctor. I have ongoing pain in your buttocks, hip, pelvic front, calves, constipation. So, hon, what you haven't said is, Rhonda, have you had a pelvic floor assessment? What's going on with your muscles down there? You know, and the other thing I'd really want to know is, are you straining? Because if you're straining to have a bowel movement and you're straining to urinate, then you are screwing up your pelvic floor and you're making it tighter. The fact that you have ongoing pain in your butt and your hips, your calves, really tells us that your muscle health might be playing a role in this. Christy says, usually a bowel movement helps me relieve some pain and pressure, but I haven't gotten control of the symptoms. I haven't gotten the symptoms under control. And you know, I'm the same way, right? So if we think about this for a moment, so look at the bladder, right? And then we can see the bowel right here. And so if you're constipated and you have a lot of stool sitting in your lower bowel, that pressure is going to be pushing against your bladder, right? And so it's very common to feel uncomfortable when you're constipated. Our challenge here is to try to figure out why you're constipated. Are you constipated because you're not eating enough fiber? Or are you constipated because you have super tight pelvic floor muscles? And the consistency of your bowel movements are really important. I mean, a good healthy bowel movement looks like a snake. It's soft and it's curvy when it lands in the toilet bowl. That is the dream. I would love to say I'm that way every day, and I'm not. I tend toward hardness and, having the equivalent of hard marbles in your lower bowel is not happy. It's not comfortable. And for me, that's because of fiber, not eating enough fiber. I mean, today I have only had 6 grams of fiber and it's 4 o'clock. I had 2 pieces of Ezekiel bread. To have normal bowel movements, women need to eat 20 to 25 grams of fiber a day. Men need to eat 25 to 30 grams of fiber a day. And so what I'm going to have to do is at dinner time, I'm going to have to make sure that I have a big serving of green peas or beans with my dinner so that I get enough fiber in there. I will tell you that I have somewhat fallen in love with refried beans in the morning. I have a local takeout restaurant that makes amazing refried beans, way better than like the refried beans in cans. and I just buy a tub of it. And every day I will do a serving, like a quarter cup or a half a cup of refried beans in the morning. Now, granted, I'm not working with people, so I'm not worried about farting in a work environment. For others, you want to eat your beans after you're home, where if you're going to pass gas, you're not worried about being embarrassed by that, right? So Rhonda says, no straining, breathing, pelvic floor. I'm stumped. I am doing the right eating that my IC can tolerate, maybe a little bit more. But how about your fiber intake? I normally don't have this problem. Something feels very tight. I'm using psyllium husk and Miralax, peas and blueberries. So the challenge with psyllium husk is that it's half soluble fiber and half insoluble fiber. And what happens for those of us with chronic overlapping pain conditions is that our central nervous system is very sensitive. And so our nerves in our skin are sensitive, the nerves in our bladder wall are sensitive, and the nerves in our bowel are sensitive. And the challenge with irritable bowel syndrome is that if we eat things that have a rough, hard texture, they will trigger those nerves and trigger constipation or diarrhea. There's a really good website called helpforibs.com. It got started the same time, 28 years ago, at the same time the IC Network, and I'm friends with the owner of that. We're both support group leaders. I was an IC support group leader. She was an IBS support group leader. But we took different turns. She very early on understood the difference between insoluble fiber and soluble fiber, that insoluble fiber is triggering. It triggers more irritation, whereas soluble fiber is gentle, and it's easier for those of us with a sensitive bowel to consume. And so I, for example, would have diarrhea every time I ate a green salad. I cannot begin to tell you the number of times and dates I went on, and God forbid if I ate a salad first, night was ruined. I mean, I'd have diarrhea within an hour, and I'd have diarrhea for a couple of hours just from eating that salad, because lettuce has rough edges and it's irritating to that skin. And she talks about that. One serving of lettuce is only 1 gram of fiber. So for those of you eating lettuce to try to improve your bowel health, it's not going to work. It's not going to work. You have to focus on the foods that have soluble fiber in them, like green peas, and that's 13 to 16 grams of fiber per serving. So the psyllium husk, I do not do psyllium husk anymore. It never helped me. I do acacia fiber. I do it every day. I put it in my smoothies or whatever I'm drinking. And let's see. Do I have a tub of this? I do. So this is the fiber that she developed 20 years ago, and it's Heather's acacia Senegal tummy fiber, completely soluble, very, very gentle, not going to irritate anything. So you might want to consider swapping out your psyllium for the acacia fiber. We have this in our shop, and what I would do is I would just get, I think this is like $8. This is a little travel packets, and this is 1 teaspoon per. I mean, you just get one of these small ones, and you just try it with this first. And then you can buy these are refillable tubs. And I just put mine in I have a beautiful mason jar that I put mine in, because I had one of these for about 5 years and it got all grody. So I just put it into a glass. So this is one of my daily things. So Rhonda says, oh, I eat salad every day. Right. And so, I mean, I eat salad. I eat last night, I had a cucumber, a yellow tomato, avocado salad. Beets would be fine. Carrots would be fine. They're putting peas in it would be fine. But it's the lettuce itself that triggers me. Leafy greens trigger me. They do. I proved it over and over and over again. And I am much, much healthier and in much less pain not eating salad lettuce. I'll eat sprouts. That's not a problem. But, I love a good cucumber, avocado, anything like that. Put garbanzo beans in it. I don't do kidney beans. I think kidney beans are a little bit more gassy. So I like garbanzo beans and peas instead. Yeah, you can get them over on our website in our store. Just go to icnetwork.org and go into our shop, and you'll see them under fiber and laxatives. But the beans you're eating, great. The peas you're eating, great. Blueberries, I don't think blueberries are particularly high in fiber. It's all about the beans, my friend, the peas and the beans. So for my elderly parents, I make a lot of sandwiches for them. And I always open up a thing of bush baked beans, and they're not irritating at all. So, all right, guys. Well, listen, we've been going for about 3.5 hours. And so let's do a last call for questions. Last call for questions. Anything I can help with? Sierra, the bladder tracker app is not available yet. We're still doing beta testing. Probably going to be another couple weeks before we can do that. David, can you cure my trigger finger? Huh? I don't know. I mean, I don't think so. I don't know what I don't know what that is. Is that thing where you get this contraction of a ligament or something, and it pushes your fingers up? I don't know. All right, guys. Well, listen, I'm going to give you your homework. Your homework for 15 minutes a day. I need you to do something to nourish your soul. Whatever it is, whether it's going to church, sitting outside in the sunshine, watching the birds, do something for you that will give you comfort. Talk with a friend, something, anything. For 15 minutes a day, I need you to do something to improve your knowledge of IC. David goes, yeah, so I was right on the contraction. Yeah, that's true. Well, actually, John Elway has commercials out right now about how he triggered his without surgery. My dad had surgery for his. Okay, so for 15 minutes a day, I need you to work on your noggin. I need you to work on your knowledge. So for goodness sake, start getting books. Like, please get our book, IC 101. It's not just a bladder disease. It's getting pretty good reviews overall. I got to get it up on Amazon. I need a twin. I need somebody here in my office that can help me. Ooh, because I am overloaded right now with all the stuff I'm doing. It's ridiculous. For 15 minutes a day, I need you to do something for your pelvic floor or your bladder. Like, seriously, for God's sake, get up off the couch, get out of bed, go lay on the floor in your living room and do your exercises. Whatever you need to do. If you need to use your wand, you know what to do. Lay in your bed, drop your pants, whatever you need to do, and let's work on this pelvic floor muscles, as I did last night. And last but not least, for at least 15 minutes a day, we got to get the joy back. We got to get the joy back. I want you to do something that makes you laugh, whether you're watching something funny or doing something funny. I want to learn all the TikTok dances. I want to learn all the BTS dances. I do. I mean, seriously, put on BTS's Permission to Dance and dance crazy around your room like I do at least once a day. Let's get some joy in your life again. Pain accompanied by laughter will be minimized by the midbrain. Pain accompanied by anxiety will be intensified by the midbrain. It is only in your best interest to start laughing again. Affirmations. I'm going to leave you with a couple of affirmations here. I am happy to be alive. There is only one of me. I am whole. I am enough. I am a leader. Goodness is coming for me. I am not other people's opinions of me. I have great ideas. My possibilities are endless. I create the life I want to live. I will accomplish things. Come on, you got to nourish your soul. You got to nourish yourself. Give your brain good, positive statements. I can do all things through Christ who strengthens me. Insert your faith. You don't have to say through Christ. You can say whatever you want to say. I can do all things through Spirit who strengthens me. Say it every day. Let's bring some positivity into that life. Give your brain something positive to focus on. Do not assume the worst. Assume the best. Tomorrow could be the first day where you're getting significant relief. All right, my friends. I will talk to you later. Be well. I will see you sometime this week. Send us good vibes about fires. We need it. All right. All right, my friends on YouTube. I'll see you later. All right, my friends on Facebook.